Okay, so good evening, sir.
Good evening, Dr. Femi. How are you today?
I'm fine, sir. So I hope you can hear me loud and clear.
Yes, I can.
Great, great, great.
And to all our audience that are joining in, I like to also start welcoming you. So nice to have all of you on this session as we discuss and talk about what is very paramount and very, very required of our health and our living. I mean, when we talk about cancer, that's one area of fight that the human race is really, really working towards. Oluwajun underscore money, you're welcome. Flying Doctors, you're welcome. It's good to have every one of you on this session. In the next 2 minutes, you can be sure we will kickstart the entire session and then we can dive into the whole details. Wherever you are connecting with us from, Lagos, Abuja, Port Harcourt, across the globe, you are welcome to this interesting session from your number one insurance company, Mutual Benefits Assurance PLC. And we are really delighted. Eniola underscore there, you're welcome. Adiola Badmos 3, thanks for joining. I can see you all coming up. Very good. Phenomenal underscore COQ, good to have you. Jesse 0546, you've also joined. Is so excited to have everybody in this evening. And we are giving you directly from the city of Lagos, Nigeria. It's good to have so many people coming in on fast, and I think we're really going to have a real wonderful session and time with us. Ori underscore fat, I can see you also. Good to have you with us. I can also assure all of you, as many questions as you'd like to raise, you can put into the questions and comment sections, and then we will try as much as possible to see what we can take in the next 1 hour. So I'd like to formally welcome everybody to this session on behalf of Mutual Benefits Insurance PLC. I call your number one insurance company, very critical to ensuring that you have the best experience with us. Now, why are we here this evening? As we all rightly know, this month, specifically on the 4th of February, was the World Cancer Day. And as part of activities in celebrating this day, Mutual Benefits, as on an annual basis, we get to discuss on issues relating to cancer. If you were with us last year, we talked extensively on the issue of breast cancer. But this year, we'll be looking at something quite different. And I would like to welcome every one of you to this platform with us. As you all know, Mutual Benefits Assurance contribution to cancer awareness is one of our key social responsibilities. And we believe the fact that having a good health is also important in you enjoying all your insurance investments and benefits. And what do we do as an organization? We say we are your number one insurance company that you can rely on for all your good general and life insurance basis. Now, for us today, we have with us a very, very good friend of the house, medical expert, who will be discussing with us on our topic, with us winning the fight against cancer, and we'll be focusing on gastric and intestinal cancer. My guest today is Dr. Femi Ajagun. He's the current head of operations for Allmark HMO. He's a product of the Lagos State University College of Medicine and has trained and worked in various hospitals, including the foremost University College Hospital, Ibadan. I'll probably say that was where I was born so many years ago too. one of the very foremost teaching hospitals in Nigeria. So please welcome with me, Dr. Femi. You are welcome to this platform this evening. Good to have you. How are you doing?
Thank you very much, sir. Well, it's really nice to be here again this year, talking about cancers and how the things we should focus on. Thank you very much for having me today, and I'm looking forward to having this conversation with us today. Thank you.
Thank you very much, Doctor. And to all our audience, I'd like to also specially welcome every one of you. If you are with me, please can you just give me a wave or give me some love, show some love to out there. I like to see that. Thank you, Adewale, Adedoyin. Excellent, excellent. Shodun Kadri Benro, thank you for joining. Please send me some love, show me some love out there. We're really excited to have you on with us this evening. Thank you very much. We appreciate that. Now, so Dr. Fem, when we say cancer, over the years, almost everyone has had someone, either a family member or a close friend, who has died of cancer. And one of the most pathetic things about this particular scourge is the fact that you really don't know something is wrong with that person. Within, you just hear somebody dies, and you're like, when did this person get sick? What happened? And then you hear cases like that, and it comes to be. I mean, of recent, we lost a very prominent governor who lands also died of one of the cancer diseases. So, breaking it down, World Cancer Day was to create an awareness and a platform from the world to really know about the scourge of cancer. So, generally speaking, first of all, take us through how much cancer has done its dread on the human population and why this awareness is very important for every one of us.
Okay, thank you very much, sir. And thank you very much for those who have joined us. Particular mention to some wonderful people I can see already amongst the viewers. I have seen colleagues from the United States, from the UK, and both joining. So, if you recall, when we were much younger, the scourge of cancer was not as it is presently. Some years down the line, you will see that a lot of people that you get to hear of cancer, you just get to hear of the story. You don't get to really know people who have come down with the disease. And as the year, started creeping in, we just started noticing that more and more people come down with cancer, by the minutes. I can tell you categorically that yes, at some point, we're thinking perhaps the reason why this incidence is increasing, or the reason why we're seeing so much more cases, is because maybe they were not reporting it so well back in the days, because we had a lot of people die for unknown causes years back, and then now we have more equipment to do radiological investigations and see what is going on. People are now going to the hospital a lot more when they have or notice diseases and things like that. And so it made us feel at some point that perhaps that was the reason. But we are seeing now that, that is not the case. It is more of towing the line of like an epidemic now.
Whoa.
If you've walked or visited a cancer hospital or cancer clinic, you would see that these days the number of people you see in cancer clinics are overwhelming. Imagine a private cancer clinic setting up to attend to only the rich. I don't want to mention names now, but a private cancer firm set up to attend to the rich, that is very rich, where, say, admission deposit is 2.5 million naira, 3.5 million naira. And yet they get fully booked. There is hardly a day you get there that the place is not fully booked, to the point that they admit people into their theater.
Oh my, oh my.
That gives us a pictorial impression of
Of
what
what we
we are
have on
going
our
through now.
hands.
It is almost as common as the typical typhoid cases that you see around.
Okay.
So it's becoming a lot commoner, and unfortunately, one of the things we see in this part of the world is that you see that a lot of when certain things happen to people and it's beyond the comprehension, most of us quickly tend to start thinking that, hey, this thing is spiritual. And because it is spiritual, we do not want to go to the hospital. And because people do not go to the hospital on time, many times by the time you get to the hospital, and it is already too late. People that are medical practitioners are not magicians. So unfortunately, there is very little they can do to help. Ideally, cancer is not a sentence. So it's not
Which
supposed to be a
which
death
is exactly what
sentence.
I wanted to ask you next. That is cancer a death sentence? Because the moment you hear we talk, they said, oh, diagnosed of cancer, the next thing that comes to mind is, oh, this person is gone. And then we all begin to think of the whole issue. Is it a death sentence?
Well, I am a living example or testament that it is not a death sentence.
Whoa.
I was diagnosed of a rare, difficult to treat type almost 6 years ago. And here I am.
So if it's not a death sentence, which is what you've mentioned, I know one of the things we hear around is the fact that, oh, early detection is key. So now going into where we are drilling down for our discourse, because I know cancer is a very wild topic. We could go on and on so many things. When we talk about early detection, what really should every one of us do, no matter the kind of cancer that might be out there? What are those things that we just need to do? And then after then, we now drill down to the main discourse for today.
Okay, I think one major thing that we should make sure we do, or let's make it two major things that you cannot run away from is one, going to the hospital on time. That was what saved my life. And two, making sure you run regular health checks. If you have a family history of any cancer whatsoever, then you might want to make your own health checks to be more frequent than other people. But then going to the hospital on time, we are very fond of one thing in this part of the world. When there's something wrong with us, it's either we are looking for the nearest available chemist or pharmacy to get some drugs, and once we take it and we feel better, we forget about it. Or in some cases, we just discuss with friends whatever it is they ask us to do. And so over time we harbor stores, and those we give those things the opportunity to fester
Doctor,
and bigger.
so based on that, could that be a result of our cultural background? Because I really think it's not even about whether you are rich or poor now. You even say the rich, like you said, you have an issue, and then the next thing is we are looking for self-treatment, medications. Some are so herbal that we try to go the traditional ways, and then we think we've solved those issues. We really don't go to the hospitals. We don't do checkups. If you take a poll, very few people will tell you they go for checkups. Could it be based on our cultural and beliefs that is making us taking those unwise paths?
Well, I think it's the function of information we are exposed to. And cultural beliefs too might play a role, because many times we are in this part of the world. Many times you see that something is wrong with us, and we quickly spiritualize it. For example, even without talking about cancers, many times when somebody has a stroke, for example, you see the first thing they'll tell you is that I lost hospital, meaning don't go to the hospital. If you go to the hospital and they give you injection, you will not get. And I've said this many times during talks. Like, I've been in a hospital where we admitted a babalawo who had a stroke, and the babalawo, somebody called him while we were doing work, and he was telling the person that he was on a powerful spiritual journey. Now, if babalawo can have a stroke and know that he should report to the hospital
The
as
hospital.
soon as possible, what stops us from reporting to the hospital?
Okay.
We are just being deceived by cultural beliefs and all.
And all that. Fantastic. Thank you very much, Doctor. Those were very insightful and enlightening prospects for us. So, going down to our discourse for today, what is gastric and what is intestinal cancer?
Okay. To put them together, they are basically cancers of the lining of the digestive system, basically the stomach and the intestines, from the small to the large intestines. So when we talk about gastric cancer, we are just basically saying stomach cancer. If you hear anything gastric, you are talking about the stomach. And the intestinal cancers, we have the small and the large intestines. Some will want to limit intestinal cancers to cancers that have to do with just small intestine alone. But then it's more than that. The intestine includes both the small and the large intestines. And when you talk about the intestinal ones, there are different types based on the origin of the cell that has caused it. We adenoma, all sorts to sarcoma, from adenomas to sarcoma, lymphoma, you know, different kinds within the intestine. It can be in the colon, it can be in the small intestine, it can be in the rectum, which is the area that is close to the anus. So, but basically, it's within the lining, the lining of
the intestine.
Yes.
Okay. So for gastric cancer, what are the, could we call it the early symptoms or the symptoms that you begin to notice or see for you to say, hey, doctor, I think you need to check this out?
Okay. You see, one of the reasons why most of these cancers appear like a death sentence is because of late detection. And the reasons why they are detected late is because they do not have particular shouting signs like that. And so when many of us feel their signs or their symptoms, we tend to overlook those things as is one of those things. For example, the signs or symptoms will depend on the stage that this thing has gotten
Okay.
to. In the early phase, you might not even feel anything. In some cases, you might just start noticing things like persistent abdominal pain or discomfort. You just see that the abdominal pain or discomfort is just not going. And this is where people who, adults who never had ulcer before, or just suddenly developed this strange ulcer. Oh, sorry about that. Who's just suddenly, notice this strange or new ulcer symptoms in adulthood, and you are trying to do everything, but it's just persistent like that. I think you should pay particular attention to it. In some people's case, they just feel bloated, and many of us tend to feel being bloated or feeling bloated is normal. But man, you feel bloated, you feel full after you eat something very little, and it was not so before. Please try to investigate it and make sure that all is well before you stop checking. In some other people's case, it might be say vomiting or feeling nauseous. That is feeling the urge to vomit, like something is irritating, you just want to vomit. For as it progresses, you might start noticing weight loss that you cannot explain. You might start noticing things like difficulty in swallowing. By the time you get to difficulty in swallowing, it's already quite advanced. In some cases, you will notice that the stool is colored. It will look like like very black kind of stool, meaning that you have bled in the stomach and this bleeding or the blood has been processed. That's why it will now be black in the stool. So those are typically signs that symptoms that people would see.
You could see. I think you made something which is very key, that is a takeaway for all of us. When we notice these body changes, we tend to assume that it's just maybe something else, because they're like regular signs you could see. I mean, in this era of where everybody's being health conscious and you're suddenly reducing weight, having weight loss, you person will probably think, oh, I'm trimming down, I'm trying to get fit, and then you need to know that something is wrong with you. Or you begin to notice that because having this unnecessary ulcer, and they say, oh, it's because you are no longer eating well or you are eating less, which might actually not be the case. And that is a signal for you to do what? Visit the doctor. Okay, so for this kind of cancers, especially let's look at intestinal cancers. You know, when you talk about breast cancer, the first thing that comes to your mind is, oh, it affects mostly the women. And then when you say prostate, they know it's for the men. For these two kind of cancers that we're talking about, are they gender specific, or which gender is at risk the most?
Okay. I would have loved for us to talk about the things that puts people at risk before we get there. But
Okay,
then,
please go
nevertheless,
ahead.
let me
Yes.
just directly answer your question. We will definitely get there. Commonly, it's more attributed to males or adult males.
Adult male. Okay.
They are more predisposed to coming down with cancer of the stomach and most of these digestive system cancers. They are usually
Why? Is it because men are more pronounced to eating all those orishirishis the more, and then they live those vices like smoking,
well,
drinking?
age.
Age.
Age is the one of the things that put people at risk.
Okay.
Then some bowel diseases for the intestinal cancer, like inflammatory bowel disease, Lyme's disease, Lynch syndrome, Crohn's disease, puts people at risk. Tobacco intake.
Okay.
Then, in the case of gastric cancer, you see that diet plays a very important role, and excessive salt intake plays a huge role. Then you see that grilled food, smoked food. Now, you see, men we are the ones that women will typically finish work now. They will close from work, go home, go and cook for their family to eat.
Doctor, you are shaking a table. Oh. You are seriously shaking a table.
Well, we are the ones that will finish from work now, and we will branch somewhere where we can get asun or
Yeah.
grilled catfish or grilled croaker and all. Those things would be spicy and they will put a lot of salt
Salt
and
in
all.
it, yes.
Now, the funny thing is that, you see, grilled foods are the longer a food is grilled, the higher the tendency of the food having having certain carcinogenic properties developed within it, or carcinogenic compounds developed in it. Some of us would even go as far as getting suya, and they will be asking them to put the fat that has been exposed to this thing,
So
to fire
the
and all.
fire and the
Meanwhile,
direct
we are
burning.
we are just consuming, using our money to go and buy these things. When meat and foods are usually exposed to high heat,
I
uh,
eat.
meat, usually it produces certain heterocyclic aromatic amines. That is the building blocks of the protein undergoes some certain changes. And so when it undergoes these certain changes, these heterocyclic aromatic amines, for example, are carcinogenic. Now, the longer it stays in that fire, the more heterocyclic and aromatic amines produce, and so the more will be consumed. And in the case of fats, their own is polycyclic aromatic this thing, and aromatic hydrocarbons PAH. And for those ones too, you see it's commoner in people who smoke too. Now, those category of people will say that they are not smoking and they are coming down with certain kind of
Disease.
diseases, not
Yes.
knowing that both themselves and people who smoke are in the same water group.
Oh. Oh, that
So,
is an eye opener.
so some of these things now, you see that men would do these things or
The
take these
more.
things even more. So it's normal for men to come down with these things more than women. It is even more common in men too. Some women do it though, but it's common in men to get uh, food now. They have not tasted the food. They don't know how the food tastes, but by default, they just get salt pincer, pa 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 pa, pa,
Yes.
adding
There are
unnecessary
people who
salts
just
that do not
love to
need.
put enough salt in it.
Yeah, unnecessary salt that they do not need. Now, excessive salt is known to actually irritate the lining of our stomach, for example, and it is also apart from irritating the lining, it is also another this thing for breeding a particular bacteria that is notorious in people who have this kind of cancer, and that is the bacteria that is associated with ulcers, this Helicobacter pylori bacteria. So that people who have been exposed to the infection of Helicobacter pylori for a long time and it is not treated, and such people are also at the risk of coming down with this kind of cancer. Now, that brings me to one point
We came to this, yes.
before I stop on this particular question you asked. Because many times you see people go to hospitals or they have ulcer, and
Yes.
rather than treating the ulcer, they just treat the symptoms of the ulcer. And we now have a mentality that ulcer now is a chronic disease. Meanwhile, ulcer
Doctor,
is
please
not.
explain that again. Treating ulcer
Okay.
and treating the source of the ulcer. Explain that. Explain that for us.
Treating ulcer and treating the
The
symptom
symptom
of the ulcer. You know,
of the
ulcer, the way the way they feel, they keep having this peppery sensation of this pain in their upper
abdomen.
abdomen or upper
Abdomen.
stomach.
Yes.
Now, and so most of them will just go to the hospital. When they get to the hospital, they'll just give them painkillers.
Yes.
They give them powerful painkillers and they keep giving them the powerful painkillers and they go, or they give them powerful painkillers and a little bit of antibiotics and they go. Meanwhile, there is an actual regimen for treating. By the time you see, okay, this person has ulcer, you investigate to see, okay, do they have uh, high concentration or some concentration of this Helicobacter pylori? There's actually a regimen that is supposed to last for close to a month that
Okay.
these people are supposed to take. But then many of us just go to, I don't know the kind of hospitals that people go to these days, or they just treat themselves, or they just use these medications they just use
To
medications to
ease the
just
pain.
to ease the pain and continue living like that. Ulcer is not hypertension, it's not diabetes. So why are you treating it like a chronic disease? But when people keep treating it like a chronic disease like that, over time, long exposure to this infection is actually one of the risk factors to coming down with stomach cancers, for example. Thank you.
Okay, thank you very much, Doctor. There's a lot you've explained to us that has to do with our lifestyle, the kind of things we eat, especially in a culture or an environment where, when it comes to salty and grilled food, it's like it's part of our DNA. They tell you, please make it more grilled, make it more dry, and all that. So it shows that we really need to change our lifestyle to be able to get the best out of this. So my next question will be that what ways can an individual have an early detection then? So can I specifically just walk into the hospital and say, you know what, I want to run a test based on this, and then is it just a general hospital? I have to go to a cancer treatment hospital. What do we really do? Actually, I'm speaking on behalf of those who, you've talked about the kind of lifestyle, and I know people who like, when it comes to grilled fish, they are A. When it comes to smoking, they are A. Drinking, they are A. All these lifestyle, they are A. So, and they're like, okay, so what do I do now? Do I just rush into a cancer center or hospital and say, you know what, just do a scan on me. I really want to know, what should we do, doctor?
Okay, there are quite a number of tests that you can do, but see, you don't have to panic. The idea of awareness is not for us to panic.
Yes.
It's just for us to get things right. See, to make life easy for you, just walk to the hospital. If you have complaints, let them know. If yours is that you want to have a comprehensive check done, let them know that you want to have a comprehensive check done, and that you would like them to include things to cover so and so, and they'll just reel out the list for you. You can go out, have those checks done, and for example, endoscopy,
Okay.
imaging tests like CT scans, MRI, and co can help to check some of these things. But then just see a doctor so that your investigations will be guided. You will not have to waste money, in this our I don't want to mention names, but in this our kind of economy, you need to manage your resources.
Very key. So it's important that you, when you visit the hospital, try and have those tests regular. So that comes to the issue where you raise the issue of us doing what you call regular medical checkups. I think it's one of the things we can use to address it. Insurance Service 188 made a question. He said, Doctor, are you saying we should avoid grilled foods?
Okay, let's say that if you can avoid it, it is better. But if you cannot avoid it, there are ways to go about this thing. One, for example, when you are going to grill your stuff, if you can first of all cook it halfway before you grill it, so that you do not expose it to too much heat.
Too much of heat.
That is one. Two is that when you cut whatever it is you want to grill into smaller pieces or smaller bits and pieces, it helps you not to require much heat to cook whatever it is you want to cook or to grill it. So it will just require minimal heat and you are through. I hope that helps.
Okay, thank you, doctor, for that. So we've talked about you going for early detection. You've identified some of these issues. Now, if you now have someone who is
Because
close to you,
somebody,
or
sorry, please,
yes,
somebody is mentioning endoscopy, colonoscopy, MRI. Yeah, yes.
yes, the
For,
BAM Fusion Clinic
yeah,
said endoscopy,
for
colonoscopy,
you can,
MRI, CT scan.
yes, you might want to add some tumor markers to that. The BAM,
Tumor markers,
yes,
okay.
because some of them actually have certain tumor markers that will be high in the body of people who are susceptible to having them or who already have those diseases.
Okay, thank you. So now, looking at those who probably have been diagnosed with this kind of cancer, what are the next steps required for them? That will be one part. And then the second part is the people around them. What kind of support do we need to give to those kind of people?
Okay. Thank you for that question. So, for those who have already been diagnosed of coming down with this thing, one is to, yes, support is very, very important because I remember when I went to the hospital and came out of the hospital and I was told about right renal cell carcinoma. It felt like the whole world had ended, and some of the questions I was asking myself and all. At some point, I contemplated just killing myself before cancer eventually. Not even waiting to see what stage it was or you know, what could happen or, you know, I just became down. So one, it is important to realize that it is not the end of the world. There are people who have had cancers, who have survived cancer. There are people who have survived the treatment of cancer and all. So the number one thing to do is to first of all brace yourself uh, psychologically and make sure that you make the best decisions. Um, I know when it happened to me, for example, my mom at some point was saying that I should go to the church. And that is one of the things a lot of us do. I am not saying that we should not pray. Prayer is an integral part of our culture, and it's very important. We get results, so there's no need or no reason for us to avoid prayers. But then it is important to seek appropriate help and to seek it on time. Uh, once once you make sure that you seek appropriate help, you know, whatever it is that is supposed to be done, and start getting help. Don't dilly-dally with treatments. There are so many other support therapy that can be done to or received to make sure that you are not so much affected. For
Okay.
example, some people consider all sorts of therapies apart from just to support them. Fruit therapy to make sure that they boost their immunity and to ensure that the effect of oncology treatment is not terrible on people. For some people, in fact, I noticed that a lot of cancer centers in Nigeria, and particularly the private cancer centers now, have included infusion therapy, where they, while
Infusion therapy.
yeah, while
Okay.
they are receiving treatment, they give them high dose vitamins via infusions so that
Okay.
they are able to
To build their
remain
body immune
healthy
system.
and so that the oncology drugs or the chemotherapy does not affect them the most. Usually most chemotherapies we have around, the way they affect cancer cells, they are also affecting the normal body cells. That's why you see that people get disorganized when they use these drugs or these medications. So they combine all these kind of therapies to make sure that the effect is the adverse effect on people is reduced as much as possible. So one, brace yourself, get support of family and friends, uh, get the appropriate care. Now, when you get diagnosed of any kind of cancer, that is not when you start going to one Abele health center. I'm sorry for my language, but that's not when you start going to see. It's something that requires specialist care. So get specialist care for that, and the earlier you do that, the better for you. Once you start seeking specialist care, make sure you do not dilly-dally with the treatment regimen that is laid down for you. And when you start receiving that treatment, ensure you get other, you know, you can get other adjutant therapies or by the side therapies to make sure that the effect of these things do not wear you down too much.
Okay. Thank you, Doctor. If I could reframe all you said, it's very important that we get counseling. It's important that if you are diagnosed or you have somebody around you who is diagnosed, that we give them the support of the family and care, which is critical. It's also important that we get appropriate care. Now, this is not about you going to what we call chemists or you just going to any hospital. It's a specialist that needs to treat this. So it's a very important that you visit a specialist, whatever private or government hospital, to get this kind of treatments for you and to move on with it. Thank you very much,
Very,
doctor.
very important.
Very, very important. I appreciate that. Now, so we'll go back to the issue of lifestyle. So I really need you to delve down into this because quite a whole lot of people will still say, yeah, from what you've mentioned, it's more or less like it's a lifestyle thing. What do we then do? And what are the things that we need to do to maintain a healthy lifestyle? Because for this kind of a cancer that is inside, you really don't know. You can't see it. And that's why you see a lot of time things happen and people are like, oh, it happens to X, it happens to Y. What are the things, the kind of lifestyle the person needs to start imbibing right now to be able to succeed and live a healthy life?
Okay, to live a healthy life, lifestyle modifications. One, do away with high salt diets. Diets. Let's start with diets.
Diets.
Doing away with high salt diets. Uh, Eating more fruits and vegetables. Um, Fruits, for one, have most of them have these antioxidant properties.
Yes.
Let's just say that most of the fruits we have around us uh, have the ability to help us rejuvenate ourselves. Let's
Oh,
put it that way. So, or let's say protect ourselves from uh,
sicknesses
certain
and
things
diseases.
within the body that's kind of wearies down the cells and make them come down with all sorts of disease conditions. So when we take fruits and vegetables often, it helps to build our immune system. It helps to keep us, fit. Really, you can't go wrong with fruits and vegetables.
Yes.
And when you do more of that, it limits you from taking more of the ones that can harm you, processed food, grilled foods, and all. So since we know that these things are risk factors, let's reduce them. Reduce the amount of grilled foods you take, reduce the amount of processed food you take, reduce the amount of alcohol you consume, reduce the amount of cigarettes you smoke. And if you have because you are not smoking cigar does not mean that you cannot also come down with these things. So all those aboki put parts, let's reduce it. Um, then another thing is that even if you're not smoking, if you have somebody close to you that is smoking, you become a secondary smoker if they do it in your presence most of the time. So try to make them excuse themselves, or you excuse yourself when
From
people around you are smoking. Those are some of the things you can do. Another thing is to look for a way to eradicate the infection of H. pylori in your system. If you are the type that you've been you've been you've been managing ulcer as if ulcer is a chronic condition.
very important. Thank you, doctor. Another question I would like to talk about is, we tend to want to go the traditional method. And from all these things you've talked about, somebody will tell me, oh, you know what? Let's try our traditional herbs, what we call agbo. It will clean your system, it will wash the system, and then it gets rid of all this toxin in your body. What's your view about that?
Agbo. Okay, thank you very much for that question. I thought of something. That was why I laughed the way I laughed. You see, among doctors, I have one fantastic privilege of living in very poor areas of Lagos. and so it gave me some insights into some of these things. I mean, I've had an alagbo around me. I have seen some of the ways they prepare these things, and oh yes, I do not, I do not actually, I don't deny the fact that herbs can have medicinal properties. Herbs can, and another thing is that the medicinal properties that these herbs have
Yes.
must be properties that are well known to you. Majority of the agbo most of us buy and we spend our money to buy, you are just buying diluted or concentrated ibuprofen or tramadol in disguise.
Mm.
Because a good number of these agbo sellers will grind analgesics or powerful analgesics or opioids, the likes of tramadol and its family members, into their agbo, so that when you take this agbo, whatever it is that is wrong with you, you feel better. And once you feel better, we feel that the agbo has worked. It's a lie. It's just deception. Somebody like me now, for example, when I feel pain, the first thing that comes to my mind is not to use an analgesic. Why? But that's the function of training, because training has made me to understand that pain is not an enemy. Pain is a feedback. And since pain is a feedback, I should I should look for what is causing the pain and try to remove it. Now, which is different from what a lot of us do with all these our agbo and co. When we are feeling somehow, we just take agbo to mask it. Most times, these agbos do not cure anything. They just help you to feel better,
Better.
and whatever is wrong with you is still there, which is why you need to seek proper healthcare.
Mm. Very critical. Very, very, very critical. So as we're rounding up, I want to call on the audience. If you have questions, please, you can drop in the comment box. For Dr. Femi, while we're rounding up, you can drop your questions in so he could address and ask those specific things. We will be able to do that in the next couple of minutes before we round up. And my very last questions for you as we round up is for you to, you've you've been able to tell us you are a cancer survivor, and you explained the fact that when you had this, even you as a doctor, you felt like it was the end of the world. So talk less of people who are not even in the medical line, what would happen to them. But since that period and you came out of it and you've become like a really high advocate of how well people can live a better life for this, when you were going through this journey and at those periods, what were the things that resonated in your mind, even as someone and an expert in the field? And then when you overcame it, what were those significant steps that you took that could be a lesson or an information for someone out there to learn from?
Let me get your question again. I remember the last one, the steps I took after the the ordeal.
The ordeal, yes.
And the first question would be,
At the point you had the ordeal, you got the information, even as a medical doctor, what sank in and what helped you take the right decision to now go through that process of treatment and to be what you are today?
okay, well, one, uh, at the time that I got the diagnosis, one of the things that was helpful for me was having great people around me. I've always been blessed with very fantastic people around me. So initially, when when the first time I heard of it, I was fortunate enough to have a friend of mine. Since I'm a doctor, let me even start from the beginning. I just had this sign or this symptom Now, the symptom is supposed to be in keeping with urinary tract infection. But then I did not see why I would have a urinary tract infection. So I started looking at, okay, urinary tract infections can come from up down. It can go from down up.
Down up.
So I started thinking, okay, if I didn't have anything any exposure that would cause a downward
Upward
infection, could it be an up down infection? What's going on? So like I said, when I have stuff wrong with me, I'm not quick to want to use medications to alleviate it. I would want to first of all, but that it's training that has taught me that. So before using any medication, I also do not. I try my best not to do any self medication.
Okay.
Instead of treating myself, I would call colleagues, see colleagues, and the worst that would happen is that I'll let them know that, see, this is what I am also thinking of, so that it would further guide them. So in that case, I went to the hospital because I was uncomfortable. I couldn't see who I was supposed to see. Somebody placed me on the medication. I started the medication. So by the time I saw who I was supposed to see and he did the preliminary tests, everything was fine. So when she said everything was fine, okay, you can leave. I told her, see, these are my worries, and so I am thinking along this line. Okay, if you are thinking along that line, okay, in that case, let us do further investigations. Let us check so and so. And so we did some imaging tests, and that was when we caught it. And so because it was not actually what we were looking for, we caught it at an early stage.
At an early stage.
So, like I said, a friend was there. So I just got out, showed my friend that, can you imagine what I just saw? Like, guy, calm down, calm down. It's not the end of the world. I don't even believe this, but let us do confirmatory tests and all. So we had confirmatory tests done. And the confirmatory test confirmed it, and it further shattered me. I could not eat. I could not. I just practically became a ghost of myself, or a shadow of myself.
Of yourself, yes.
So one day, I didn't tell anybody. I didn't tell my brother who was staying with me. I didn't tell anybody at home. I just continued doing my work, and my HOD just called me like 2 days later that, come, you went to the hospital. What was the outcome of your
test? Yes.
So I told him, this is the outcome. And you kept quiet, and you are at work. What? Are you okay? What?
Support system.
Yeah, support system. So immediately he called the MD, told MD, and immediately told MD. They just called the best urologists they could get, and that was it.
Wow.
I was with the urologist. I saw the urologist. He drove me to the urologist that day. I saw the urologist, and I think within 5-6 days, I had gone through surgery.
Wow.
Well, unfortunately, that particular type of cancer is resistant to chemotherapy. So even if you do chemotherapy, it's worthless.
It would not have
resistant to radiotherapy. So if you do radiotherapy, it's worthless. So the best thing is to get it early and to get it out
as possible and get it out. Wow.
So it was at that point my mom came and said that, let's go to church. So my MD and my colleagues had to prevail over her. Mommy, you go to church to pray while we have surgery
and the treatment going on.
And all. And so she went ahead with her prayers while
we let the specialist continue.
And everything went well. Did follow-ups and all, and that was it. That was what happened during that period. So it was really friends, because usually when such things hit you, you might not be able to think straight. So it was people around me, the support system I had, that was basically it for me.
He's doing it for you. And I
Yeah.
would say the right support system also.
Yeah, the right support
I
system.
mean,
Because some support system will
your
push you.
colleague, your boss, how they were able to marshal you to take, even though you're a medical person, you just sat back and were like, what is happening now? I don't know what to do next. And then they were able to marshal you into the next stage and to the next stage, which is very critical. I think having a great support system gives you about 25% of your victory in
Well,
this case, because
I agree with you.
yes,
I agree with you on that.
that's very
So
fantastic.
afterwards, after the whole thing, and I had to make sure that I kept my appointments, you know,
Okay.
so kept doing checks from time to time to make sure that there is no issue and all. There were some consequences of the surgery. I just start to use that word so that most people would understand. Consequences of the surgery that we needed to work on. But thanks for support system too.
Was able to
Everything
overcome.
was like a walk in the park. I know there are some of them on this chat right now that, even if we've not spoken for a year, when they reach out, they want to know when was my last appointment,
Appointments.
what my results were,
Oh,
and things like that.
and all that. I think what you've done for us is, like you say, you've spoken from the horse's mouth, and good enough, being an expert in that field. It tells us that this scourge, he does not is not biased. He doesn't care what field you are. He doesn't care whether you are young or old. He doesn't care. It comes and like you rightly said, awareness is very, very important for us to drive it home. I wouldn't know if we have any questions, comments from my audience. None yet, none yet, none coming in, because we will be rounding up very, very soon. None coming in yet. I think for the audience, please show some love to Dr. Femi. Please show some love. I really appreciate that for the time he spent to expose quite a whole lot of things to us about going early detection, going for your regular checks, ensuring that you're getting counseling, ensuring that you build a good support system. So it's not just about having a support system, you must start building that support system, because you might need it in one day. Uh, Dr. Femi, my final question, and as we round up, I know medicine and the world of research is doing quite a whole lot to see how well they can fight this scourge of cancer, whatever form it is. I mean, there are a lot of research going on in areas of drugs, a lot of research going on in areas of things that could be done. But the underlying fact of it for everybody is that lifestyle plays a major role, and environment, genes, and all that plays a major role. So, as an expert, considering what we've talked about, stomach cancer, intestinal cancer, what would be the parting word you're going to give to our audience out there while we're still waiting for that, what will I call it, that particular dose that will do the magic?
Well, what I can tell every one of us right now is that, one, cancer is not a sentence.
It's not a death sentence.
It's not a death sentence. The important thing is to catch it early.
Catch it early.
Now, we might do so many things, and even while avoiding the risk factors and all, one might still not be able to avoid having
Avoid.
it. But
Yes.
even if anybody is going to come down with it, it's very important that it is caught early. Once it is caught early, the chances of a successful treatment is very, very high. Very, very, very high. And concerning the lifestyle uh, approach that we talked about, I would like to just encourage us that, see, the very building block or foundation of any achievements we might have in life or we might think of in life is our health. It's quite
Exactly.
important that we pay very good attention to it. Thank you.
The very foundation building block of our life is our health. We need to take it very, very important. And Dr. Femi, Duchess 8988 dropped a question which I would like for you to answer. He said, does it mean if not detected early, it can't be cured? And what happens even after it has been removed?
Okay. If it is not detected early, the chances is not that it cannot be cured, but the chances become lower.
Lower.
And the second question is,
what happens even after it has been removed? So you hear
after it
cases of
has,
they've done the surgery, they've removed this. What
okay.
happens? What are the chances?
So after it has been removed, there is a chance of reoccurrence. That's one. Two is that despite being removed, there are some of them that would have actually spread, so that even though you removed it, the ones that are spread already will still be there wreaking havoc, which is why it is important to follow up with chemotherapy or radiotherapy, whichever way or whichever one is recommended.
It's recommended.
But in some cases, surgery alone would even be enough, and that will be the only thing will be that such people will now have to be watched like a hawk.
Hawk, yes.
Yeah, so that if anything is happening anytime before it goes far, it is caught on time.
Thank you very much, Dr. Femi Ajagun. We are really, really excited and grateful for the moment you've spent with us, the insights you have given, the advice, your expert opinion, and also sharing your story with our audience today. For all our audience, I want to say thank you to all of you out there. So many people joined later on. Lafem, eBaby, Fast Ride NG, the BAMF Clinic. Thank you for joining. I am _Stephen_Laika, and so many of you there who have joined us today. Last 1 hour, we've been talking about how we win the fight against cancer, and we've looked specifically into gastric cancer and intestinal cancer. And this has been brought to you from your #1 insurance company, Mutual Benefit Assurance PLC. You can follow us on our Instagram, Facebook, Twitter page, or on LinkedIn, or you can also reach us in any of our branches close to you, or you can go on our website, www.mutualplc.ng, and you can be sure we will be there to discuss or have a conversation with you or anything relating to your general insurance or your life insurance. We are there for you. And this is one of the platforms we use to also raise awareness and support the society. Dr. Femi, we are grateful. Thank you once again. And we appreciate,
Thank
and
you
I
very
do
much.
hope that next time we will come up to also discuss something much more topical and important to the well-being of everybody. Thank you very much, and do have a wonderful evening.
Thank you very much.
You're welcome.
Have a great day.
And you too. To all my audience, thank you. Appreciate you. And we will see you some other time. You can all end by sending me some love. Let me see your love emojis dropping as you are all signing out. Thank you. Thank you. Thank you. I like to see your love emojis as you are all signing out. Thank you very much.